This is a presentation on nurse burnout by Trisha Lucas. Thanks for watching. Whether novice or experienced nurse, burnout can affect anyone. Internal and external expectations. Nurses already have high expectations of themselves. This compiled with external expectations can add stress and frustration. Your nurse manager comes around the corner and asks for another 12 hours this pay period. Always running short, always needing extra shifts. Patient families can be a blessing, but they can be very challenging and sometimes way more challenging than the patient themselves. Medication errors, definitely don't want to make medication errors. That's very stressful to think that you could harm your patient by making a medication error. Charting is endless, never seems to be done. Charting's the type of thing that wakes you up in the middle of the night or day and you ask yourself, did I chart that? Pain reassessments, that's something we're dinged on if they're not done within 90 minutes of pain medication administration. Time constraints, it seems like nurses run on a time clock 24/7. We have this much time till we have to do this task. We have this much time until we have to repo this patient. We have this much time to hang an antibiotic. Always this many minutes till the next thing we have to do. Pharmacy, we're always waiting on that one last medication before we want to go in and give patient meds. Not always. Don't want to be too rough on pharmacy, but sometimes it seems like it. And doctors are busy, but so are we. Performance indicators. If you're like my department, we have an entire wall of charts that are refreshed monthly or quarterly that document falls without injury, hospital-acquired pressure ulcers, hospital-acquired pneumonia, quietness at night, timely follow-up with doctors, follow-up of critical labs, all the things that we're constantly being documented on, and many of these things base our reimbursement or the hospital's reimbursement, which makes them very important. Stressful workplace environment. This is one of the primary reasons I moved to night shift weekend option. Reduce my stress. Not that it's much less stressful, but so some of the things that can affect our workplace environment are floating to other units, having to park at least 2 blocks away. Nothing says we appreciate our employees like parking 2 blocks away, and walking in the winter and the rain and the snow doesn't matter. Required extra shifts, nurse-patient ratios, staffing shortages, the long 12-hour shifts, and broken equipment, having to deal with that. And these requirements add stress and take away from providing excellent patient care. Another stressful dynamic is coworker drama. Competition between nurses, complaining, refusing assignments and refusing admissions, coming in late, not ready for a report, overly needy nurses, perpetually leaving tasks for the next nurse, and a lack of teamwork. These are very draining for the nurse and just makes for a stressful work environment. Challenging patients. I don't know if we can go a shift without at least 1 or 2 or 3 of these. Patients that require hourly bathroom trips, if not more frequently. Constant call lights. The call lights are endless. Patients with confusion. A lot of times they're just taking extra patients, but when you're out of patients, it's very stressful. Hearing or visually impaired just takes extra time, which causes stress because we don't have extra time. Delirium, psychosis, the very, very sick patients that we're worried about. Patients that sundown, patients that complain a lot, bed alarms, definitely alarm fatigue. Combative patients, patients that abuse substances, patients that are detoxing, agitated patients, Times to assist patients, again, needing extra time and extra resources that a lot of times we don't have. Q2 repos and patients with poor IV access, they all present a challenge and added stress. Other departments. Providing excellent patient care requires that we depend on other departments. This can be beneficial and burdensome depending on the circumstances. Other departments such as dietary, pharmacy, emergency department, radiology, dialysis, PACU, laboratory, and of course doctors. Nursing is a complex career requiring collaboration with a lot of different departments to meet patient needs. It is inherently stressful. Nurses need to find relaxing techniques to manage the work-related stress of the job. Thank you for watching this presentation.